A 22-year-old goldsmith comes to a clinic. 22-year-old goldsmith. So for goldsmith, what do you have to do? So they have to work at like, yes, Preeti and Priya, anything you want to say? Okay, so they need to work very at near, right? So like our normal working distance is around 33 centimeter or 40 centimeter. For goldsmith, thinking that they have to work at 20 centimeter because they have to do those fine design of those ornaments and all. So they have to hold it very near and work. Okay, so what is the problem of the patient? What was the problem of the patient? So the 22-year-old goldsmith had a blurring of distance vision after near work. So he does 10 hours of near work daily. 10 hours of working near work he is doing daily. And suddenly if he is looking at distance, he is find everything to be blurred. Okay. So his uncorrected vision was 6/6 in right eye and left eye also 6/6. Retinoscopy, what we have found out it is plus 0.25 for the right eye and plus 0.25 for the left eye. So blurring of distance vision immediately after near work, after 10 hours of near work, that was his problem of the goldsmith. So NPC was 6 centimeter, that means his convergence was very good. Covetous distance ortho, near it was 2 prism exophoria. Okay, so slight exophoria the patient was having. Now let's come to the AC by A ratio. It was 5.2:1. So quite normal AC by ratio. So if the patient was having a minus power, if we would have prescribed the minus power, it would have taken care of this near 2 prism exophoria. See, believe me that all of us are having actually many like around 4 prism, 6 prism of exophoria, all of us are having. So we can work with that. We don't find any difficulty with this minimal amount of exophoria or esophoria. Okay, now let's come to the basin value. Basin for distance, it is x7 and 4. Basin for distance, that is quite normal. Okay, basin for near, it is 13. Normally normative value is 13 and 10, break at 13 and 10, recovery at 10. So it is quite okay. Base out value, let's come to that. Base out for distance is x20/10. So base out for distance, normative value is break at 11 and recovery at 7. So it is little bit greater. Near base out value is normative value is 19 and x 19 and 14. So that is also quite okay. Okay, so base out value, only base out for distance was little abnormal. Now let's see this. What is the case? NRE is plus 1.25, that is quite low. PRE is minus 1.50, that is also quite low. NPC is 6 centimeter, that is normal. Patient is having distance vision problem. Now the patient age is 22, right? 22-year-old goldsmith. So his accommodation, it is 12 diopter, that is quite normal. Quite normal accommodation, because 11.9 should be the normative accommodation. But accommodative facility was 0 cycles per minute. Binocular accommodative facility was also 0 cycles per minute. MEM retinoscopy was plus minus 0.5. That is quite normal for all of us. So we normal lack of accommodation. So what may be the case? Yes. What do you think? What may be the case? Yes. Accommodation is quite normal. Okay, NMVPFV value is okay, not like it is okay only. 2 prism exophoria for near, distance orthophoria. NRA PRE, if you look at, it is very low, plus 125. PRE is minus 1.5. Amplitude of accommodation is quite okay. Means accommodation of the patient is quite okay. MEM value is also shows a normal lack of accommodation.
Ma'am, I think convergence insufficiency this case.
Not convergence insufficiency. Why? Because NPC is 6 centimeter, you can see. Okay.
Yeah, right.
NPC is
So my
600.
patient has the accommodation facility problem.
Accommodative facility problem, definitely. Why? Because the patient cannot clear the plus or minus lenses, 0 cycles per minute. So if you are doing with a plus minus 1 flipper also, the patient is not able to clear the plus or minus lenses. So that is accommodative infacility. So normal amount of accommodation patient is having, but the patient cannot, like from near, accommodation means what, नियर से डिस्टेंस तक मुझे देखना है, नियर भी देखना है, फिर अचानक डिस्टेंस देखेंगे तो डिस्टेंस भी क्लियर देखना है. So again, when I'm focusing from distance to near, I should see it clear. So that is the patient's main problem. See, the patient's complaint was blurring of distance vision after near work. So accommodative infacility. Okay, so definitely we need to give a heart chart. We need not to give prescribe any glasses and all. We need to give the heart chart exercise to the patient. It will improve his accommodation part, accommodative facility. Also we need to give the flippers exercise to the patient. Definitely we need to give the flippers exercise to the patients. So we can start with the plus minus 1 flippers, because he cannot clear the flippers at all. 0 cycles per minute it was, right? So basically this is a case of accommodative infacility. Okay, any questions? Please tell me. So that's the end of all the cases. So case discussion classes is ending here. So any questions, please to ask me.
Yes, ma'am, I have questions.
Yes, please.
Ma'am, actually